By Worldwide News, May 16, 2025. As Nigeria navigates its complex health challenges, the nation faces a renewed battle with a familiar enemy, Lassa fever. The Nigeria Center for Disease Control and Prevention, NCDC, has confirmed 138 deaths and 717 cases across 18 states in 2025, marking one of the most severe surges in recent years. The rapid spread and high fatality rate underscore the urgent need for stronger health systems, public awareness, and sustained national attention. This isn't just a health story, it's a national alarm. What is Lassa fever? Lassa fever is an acute viral hemorrhagic illness, endemic in West Africa, and caused by the Lassa virus. Humans typically contract the virus through contact with food or household items contaminated by urine or feces of infected multi-mammate rats, a species common in the region. Person-to-person transmission is also possible through contact with an infected individual's bodily fluids. Symptoms can range from mild fever and general weakness to severe conditions such as bleeding, respiratory distress, or multi-organ failure. The incubation period lasts between 6 to 21 days, making early detection and intervention critical. 2025 Outbreak. Key facts according to NCDC's latest situation report, 138 deaths recorded as of May 16, 2025. 717 confirmed cases across 18 states, with Ondo, Edo, Bauchi, and Benue among the most affected. Case fatality rate, CFR, currently at 19.3%, an alarming increase from last year's 18.0%. The most affected age group is 21 to 30 years, with males slightly more impacted than females. 3 healthcare workers have been infected during the response, highlighting occupational hazards. Why this outbreak matters? This outbreak is not Nigeria's first, but its intensity is a reminder of persistent systemic gaps in the country's healthcare system. Unlike the rapid global responses to diseases like COVID-19, endemic illnesses like Lassa fever often receive fragmented attention, despite their devastating impact. The implications go beyond public health. Economic strain. Lassa fever outbreaks affect local economies, agriculture, and mobility, especially in rural areas. Pressure on healthcare systems. Already stretched facilities must now allocate more resources to containment and treatment. Loss of productive population. The most affected demographic, young adults, represents the economic engine of the country. Government response and containment effort. In response to the rising toll, the NCDC has activated its incident management system, deploying emergency teams to hot zones. Local governments, in coordination with federal health authorities, are conducting contact tracing, providing supportive treatment, and launching public awareness campaigns. Hospitals in affected regions are being reinforced with personal protective equipment, PPE, though reports of shortages persist. Despite budgetary limitations, there is a renewed push to educate communities on basic hygiene practices and rodent control, simple yet powerful tools in reducing transmission. The way forward. Lessons Nigeria must learn. Invest in health infrastructure. Nigeria needs more than short-term interventions. Long-term investment in diagnostic laboratories, treatment centers, and rural health access is vital. Strengthen public health education. Many Nigerians still rely on misinformation or local remedies during outbreaks. There must be consistent, accessible communication about prevention and treatment. Prioritize local disease surveillance. Early warning systems and community surveillance structures must be modernized and integrated into Nigeria's national response frameworks. Support frontline health workers. The infection of healthcare workers is a painful reminder that they are often underprotected. Their safety must be a national priority. Regional cooperation. Since Lassa fever is endemic to West Africa, Nigeria must collaborate with neighboring countries on cross-border surveillance, research, and funding. A public call to action. As citizens, there's a role we all must play. From storing food properly to keeping homes rodent-free, basic hygiene can be life-saving. Communities must also report suspected cases promptly and discourage stigmatization of patients. Religious institutions, traditional leaders, and local influences must also be mobilized to disseminate accurate health information. The battle against Lassa fever isn't just a government issue, it's a collective responsibility. Final thoughts. Nigeria stands at a crossroads. The rising Lassa fever death toll is a tragic reminder of the vulnerabilities in our health system and the fragility of public health in underserved regions. But it is also an opportunity, a moment to rethink, rebuild, and recommit to the health of our people. Let this outbreak not just be a statistic, but a turning point. Loudspeaker, join the conversation. Share this article, tag your local leaders, and advocate for sustained public health funding. Soap, stay safe, practice proper sanitation, report symptoms early, and spread awareness, not fear. Newspaper, follow World Wire News for accurate updates on Nigeria's health and security developments.